This time we're going to explain the full process of elbow taping. And the stuffs being used are adhesive spray, so a pair of scissors, lightweight and heavy elastic tape, and 1 inch and 1/2 inch elastic tape, and last pre-wrap. So let's begin. So start by holding the patient's hands to a shake hands position. But however, we can first start by applying the adhesive spray from the mid forearm to the proximal position of the biceps muscle region. So however, we can see that I have already finished that, but our patients just move a little bit. So, and now we can start by applying the pre-wrap from the surface that we kind of sprayed. And for the most important part, you're gonna leave some little gap on the other side of the elbow to make sure your patient, after the taping, your patient can still like practice or do some little training after, and with the injury being protected well. And apply the pre-wrap all the way down to the mid forearm. And we can just skip this, but just to make sure that your pre-wrap was being well wrapped without any like sprinkles or such stuffs. And now let's pick up the 1.5 inch electric tape. So to do some top and bottom anchors like we did in the last time on the ankle taping. So it's kind of similar. And this shall be around the proximal biceps muscle region and in a proximal to distal fashion. So just apply this 2 to 3 times, I think. Just that's enough. After we did 3 top anchors, and now we move up to the bottom anchors. And this shall be applied the forearm in a distal to proximal fashion. So also applying 2 to 3 times. And at this moment, we can kind of ask for the patient to contract their arm against our tape. So for their arm to avoid like any kind of excessive tightness of the tape. And moving on to the most important step. And just take our 1.5 inch heavy elastic tape and apply. And this shall be run all the way down from the proximal to the distal anchors. So like just top to bottom. And just carefully cut the tape to avoid any kind of sprinkles and apply it very carefully on the patient's arm. So just to make sure it shall be run all the way down from the top to the bottom. So the proximal to distal anchors. And we'll be making 3 in total of these kind of tapes. And just make sure it shall be very tight. And so now for the second one, it will be kind of different. So we shall be following the first one, overlapping it. And it shall be traveling all the way down in a lateral to medial direction. And for the last one, the third one, obviously from the medial to lateral direction. And this shall be a very nice and well protected tape. And as we take our lightweight elastic tape, the 1.5 inch, I think, and we just wrap it around and make sure it's high enough, just to cover the all the tapes that we have done. Yeah, so that's it. And after these, we have 2 more anchors to go. And this moment, just always remind yourself that the bottom of the elbow is not going to be taped, and it shall be free and just nicely movable. And at this moment, we used our 1.5 inch standard as the electric tape to use it a closing anchor. So just one strip is enough. And following by this, I also did one top anchor to make sure the tape just will stay very nicely in its place. And after all these, you can just let the patient just walk up a little bit and just move around that their make sure their elbow is nicely immovable in a very nice position. And as you all can see, the bottom of the elbow remained untaped. So this taping was a success, and see you all.